Health Secretary Robert Kennedy Jr. plans on telling the CDC to stop recommending fluoride be added to public drinking water nationwide. The move comes as the Environmental Protection Agency reviews new scientific information on the possible health risks of fluoride in drinking water. Joining us to talk about this and the possible benefits and risks with fluoride is Dr. Jeff Pothof, UW Health's Chief Quality Officer. Good afternoon, Dr. Pothof.
Good afternoon.
So there was a time once long ago when fluoride wasn't in water. So there was a reason. Talk about the reason why it's added and why some people have concerns.
Yes, so back in the 50s, municipalities started adding fluoride to water, and this kind of spread around the world. And there's armfuls of studies that show that when municipalities started to do that, the rate of cavities, especially amongst kids, decreased about 50%. Now, that was the 1950s. There are other sources of fluoride right now, toothpaste, mouthwash, but still an estimate that fluoride in our drinking water reduces cavities about 20%. I think the concern around fluoride comes from some observational studies that suggest if you get too much fluoride, it can actually reduce IQ. Those studies would suggest that you need about 1.5 milligrams per liter of fluoride in your water to see a drop in IQ. Currently, the United States recommends 0.7 milligrams per liter, so half the rate that would require, some sort of problem with IQ. So there is some truth on both sides, but probably a good idea to study this just a little bit better, particularly fluoridation that is low, like we currently do in the United States, to see if there is any impact at all on childhood IQ.
I'm always so critical of these studies because maybe they're not drinking water, but maybe they're doing other things that might lower their IQ. So we don't know what all the variables were. Let's talk about—
You make a good point, Kim.
Yeah.
There are countries in the world that don't do fluoride in their water, and their cavity rate is as low as ours in the United States, but they do other things. They put fluoride in school milk, or they do rinses of the mouth at school with fluoride in Japan, which kind of function the same as fluoridating in your water.
All right, Alzheimer's and sleep. There is a study that the amount and quality of sleep may have some impacts on Alzheimer's.
Yeah, this is just a growing list of things that make us all want to get more sleep at night, even though it's really hard to do it. This study looked at sleep and not just duration, so that 7 to 8 hours is important, but how deep did that sleep get? So individuals who got more deep sleep, and a particularly kind of deep sleep called REM sleep, rapid eye movement sleep, the parts of their brains didn't get smaller. Those who didn't get that good sleep, the parts of their brains that can sometimes lead to Alzheimer's, got a little bit smaller. So there's this potential association, not proven, that by getting less deep sleep and less sleep, you might actually increase your risk for Alzheimer's. Early study, more research needs to be done, but another reason to try get your winks in every night.
Blood tests to detect Alzheimer's, that's huge.
Yeah, this would be a great test. It's still early on. We got to do some validation on it, but there are plaques that form in the brain. These tau tangles. This blood test actually looks for pieces of that tau tangle that break off. And researchers have looked over a number of patients. The level that you can measure in the blood, it's lower when you're preclinical with your disease. As your disease advances, those levels increase. This could be a simple blood test versus what we need to do now, which is PET scans, lumbar punctures, much more invasive, much more expensive tests, but a little bit more validation to make sure it's sensitive, make sure there aren't any other brain conditions that would increase this lab value and kind of confound the results. But something to look forward to over the next couple of years if this pans out.
I'll say thank you, Dr. Pothof. Have a great afternoon.
Thank you.